One of the common questions I get asked is, how often should I replace Momcozy M5 pump parts? So let's dive on in and answer that question. How often should we be changing the Momcozy M5 pump parts? Well, it really depends. There's a couple of factors. One is the different pump part as well as your frequency of use. Somebody that is an exclusive pumper will need to change certain parts more regularly than somebody that is only an occasional pumper. That said, over time, your pump parts, especially these silicone parts, will become worn out, they stretch, and you lose your pump suction optimization. So we want to be replacing these parts regularly to make sure we're maintaining our pump. Secondary to that is if you have parts such as your cup that get damaged or scratches, they can harbor bacteria. So it also becomes a hygiene issue. So let's have a look at the different part pumps and how often they need to get replaced. So first we have your diaphragm. You can see that this is a silicone diaphragm. It's very flexible over time. So this in your pump moves, in and out. Over time, this gets worn out, it becomes stretched, but this is a very critical part of your pump and maintaining the suction. So we need to be replacing this every 1 to 3 months, again, based on your usage. You can easily see when this isn't fitting quite right inside your pump. It won't have that secure fit. If this starts becoming loose, or you can see that it's just not looking quite right, definitely go ahead and replace this. The other one is your duckbill valve. And again, if your pump, you're feeling that you've lost suction or you're not getting as much output, generally speaking, I would replace these two parts and see how you go. Your duckbill valve opens and closes, and this again is part of your suction. If you see that it is slightly open, then it is time to replace this. Again, every 1 to 3 months, this should get replaced anyway, depending on your usage. Next, you have your flange. Now you can see again, this is one of those silicone parts that can easily stretch, especially around the edges where it connects to your collection cup. If this starts becoming loose, you may end up with leaks, as well as loss of suction. So again, one to replace. However, this does not need to be replaced as frequently as your valves and diaphragms. This is around every 6 months I would replace your flange, unless you can see that it has visible damage on it, and then it becomes a hygiene issue. The same goes with your flange insert. This sits inside if you need to reduce your tunnel size. Again, every 6 or so months, depending on your usage, and if there is any damage, then replace them immediately. Lastly, we have your collection cup. Now, this is a hard plastic. It is not the same soft silicone. It's not going to stretch. Replace this if it gets damaged, if it gets scratched. This is on an as-need basis. And then obviously you have your pump motor. Now this shouldn't need to be replaced unless it gets damaged. So hopefully that does not happen for you. So in terms of regular replacements, we'll go over that quickly again. You have your diaphragm and your duckbill valve that needs to be replaced every 1 to 3 months. These are critical for your suction. If you are losing suction in your pump or getting a low output, replace these and see how you go. It's a really easy troubleshoot. Next, you have your flange inserts every 6 or so months, depending on your usage and wear and tear. And then again, your collection cup on an as-need basis for hygiene purposes. So I hope this helps. If you have any questions, please ask. I will pop the link in the comments to all these replacement parts. They're pretty inexpensive, so hopefully that helps. If you've got any questions, please ask.